We've got a great attendance for this fabulous session, a rather curious subject that we're all starting to learn about these days, and I think most of us are fascinated. And so we're going to have a very interesting and informative discussion from a man who has been instrumental, Mr. Paul Mavor, a pharmacist who has conducted research on medical cannabis and its application for healing for various cases, illnesses, and its effectiveness. And the controversy, I guess, in the medical profession is still being dealt with across the world, and particularly in Australia. And Paul will also be able to address that. So could you give him a warm round of applause, Mr. Paul Mavor? Thank you.
Thank you. Great turnout. Thank you all for coming. So a bit of background about me. I've been a retail pharmacist for 30 years. Most of that time I've seen cannabis as a dangerous recreational drug that's highly addictive. I don't think that anymore. But over the last 3 years, I've been researching medical cannabis as a treatment option for patients. And whilst it isn't a universal panacea or cure-all, it does have really good benefits for some patients, for some conditions, particularly chronic pain and particularly neurological diseases. So I just want to make that very clear that it's not a magical cure. I'll go through some of the evidence shortly. If you want to have a copy of some of the slides, particularly the safety data, to convince your health professionals it might be a treatment option for you, then please note down that email address or grab a card at the end or add me on Facebook. I'm more than happy to send you anything or communicate with you. I'll be opening up the floor for questions at the end, so we'll take a few questions, but please, if you don't get a chance to speak to me, please feel free to contact me directly and I'll do my best to try and help you. So, over the last 3 years, my wife Charlene and I have been travelling the world looking at cannabis, and normally when people get into drugs it's a downhill spiral, but for me cannabis has actually been quite a positive thing. I've literally travelled the world. I've been to the US. The first time we went to the US, we attended cannabis boot camp, and I fully expected the first time going to the US I'd be taking my kids to Disneyland, but cannabis boot camp in Portland, or Potland I like to call it, it was funny because when we did, all our other friends from school were Facebooking pictures of being on the beach in Bali or Coral Bay, and we were nightclubbing with Tommy Chong and going to cannabis boot camp and looking through cannabis grow facilities and dispensaries. So from there, we've also been to Canada, Israel. We recently got back from the east coast of the US, Colombia, of all places. I'm not sure if you've seen the TV show Narcos. That was my research for going to Colombia. And Chile, which we visited a clinic that's seen 20,000 patients in the last 5 years. They've had some amazing results. They've been writing down all their research, and they've been teaching some of their patients to grow cannabis and extract it and make their own medicine. But I'm pretty thankful in Australia we've adopted a medical system. Other places around the world, they've opened a dispensary model, which I don't believe is a good way to distribute cannabis. People sometimes need more than cannabis. They need other drugs in their life. We've got some other great pharmaceuticals in Australia, for instance, cholesterol tablets, heart tablets, antibiotics that, with our universal healthcare system, unlike the US, are readily available to the public that need them for a very reasonable price. And as a result, we've got I read we've got the third highest life expectancy anywhere in the world, beneath Iceland and Japan, because they eat a lot of fish, basically. So eat more fish in your diet. So in Australia, they pretty much legalised cannabis overnight. In February 2016, in less than 24 hours, the Australian Federal Parliament legalised medical cannabis, which shows the broad political support and the community support for it. And the very same time they passed the cannabis legislation, they were actually debating the same-sex marriage bill. I'm not about you, but I voted yes. Anyone here else voted yes? And it's actually quite amazing they passed both sets of legislation. It's even quite biblical, because as the Holy Book says, when a man lays with another man, they should be stoned. It's true, the Bible says so. So by way of disclaimer, I run a pharmacy in Wangara. It's open every day of the year from 7 a.m. to 11 p.m. I've been a pharmacist for 30 years. I'm the Australian agent for one of the cannabis oils. We imported the very first shipment of medical cannabis into Australia in May 2017. And I run a company called Health House, which distributes cannabis to pharmacies around Australia. So I'm not going to talk any specific products today. I'm going to be talking about cannabis in general. Ethically, I can't talk about my particular brand of cannabis. The biggest disclaimer I want to give, I'm not a cannabis user. I've never used cannabis medically, recreationally, spiritually or otherwise. My poison of choice is beer, because it makes my jokes funnier and gives me flawless dance moves. I was actually RBT'd on the way here today, which is quite bizarre. But this picture is actually taken in Portland when we attended Cannabis Boot Camp. We did a few other fun things like going to Hooters, we shot assault rifles, and we did a cycling brewery tour. And it was a really fun day. The very same company did the cycling brewery tour also did a cycling cannabis tour. And they gave all the participants a joint and the edible at the end and went to 3 dispensaries. We didn't do that tour, but it looked like a fun tour. And some of the safety data I want to present today compares the harm from cannabis to alcohol. And cannabis doesn't fare too bad. Not that I'm going to give up booze anytime soon. So, flashback to the 80s. That's why everyone's got shoulder pads and big hair. But I studied pharmacy at Curtin University, and at the time our education in cannabis was along the lines of if any of us pharmacy students were ever at a party and someone lit up a joint, we were to leave that party immediately. Became a bit of a running joke, no one ever did. That's actually John Worsfold there if there's any West Coast Eagles fans in the audience. But one of my current pharmacists, her education from a couple of years ago by the same Department of Pharmacy was presented in a half-an-hour format by a policeman, which covered all illicit drugs, including cocaine, heroin, LSD, nothing on cannabis in there, which is like a nun giving you a class in sex education. It's not that scientific, and to me, I've been travelling around Australia educating health professionals. Over the last year, we've conducted over 30 seminars for health professionals, and we've educated them about cannabis as a medicine. So, in order to study cannabis as a medicine, I went to the world's biggest scientific journal. Sorry, can you see that? Facebook. And I found this meme on Facebook, and it showed some real-life US morbidity data circa year 2012. It's presented in this format, but you've got the usual suspects at the top: cancer sticks and sitting on couches, responsible for a huge toll. Underneath that, my favourite beer, responsible for 85,000 deaths each year in the US. But the one that really surprised me was prescription drugs. Largely pharmaceutical opioids that are responsible for this huge toll each year in the States and other countries around the world. And as a health professional, I feel responsible because these are largely what I consider preventable deaths. People don't need to die from this if counselled correctly or used sparingly or given an alternative treatment. And right down the very bottom, on beneath peanuts on 100, was cannabis responsible for 0 deaths each year in the US. And I thought, no way. How can a drug that is that dangerous, that pharmacists have to leave parties from, be that safe? And it turns out it is very difficult to overdose on cannabis. You have to eat something like a ton of this stuff within a very short time to overdose on cannabis, which doesn't mean that all cannabis use is safe all the time. Obviously, it's not safe to have cannabis and drive, and there might be pesticides or heavy metals or other impurities in your cannabis. But as a drug, dose-wise, it is very safe from overdose if you take large quantities. So we looked at some broader data in the US, and there was a rising toll from pharmaceutical opioids death, and some recent CDC, Centre for Disease Control, data released showed in 2016 in the US there was 60,000 overdose deaths. And of those 60,000, 40,000 were for pharmaceutical opioids. From 2012 it climbed from 32 to 40,000, and 0 deaths every year from cannabis. It's a aerobics class going on outside. So we pulled some Australian data, and there was a very similar story. I'm not sure if you can read some of these numbers, but in 2012, 577 people died in Australia from pharmaceutical opioids, and 0 from cannabis. So there's a trend happening here. This looks really complicated, acute lethal toxicity. This further explains where cannabis sits on the scale. How this works, heroin being the most dangerous drug with a ratio of 1 to 6, how the ratios work is the figure on the left. I'll email any of these slides to you so you got a good copy. You're welcome to take pictures though. But heroin's got a ratio of 1 to 6. The figure on the left is 1. It's 1 in every single case. That's how much of a drug you need to give a dose. The figure on the right is how many doses will it take to overdose. Heroin being 1 to 6, alcohol 1 to 10. In practical terms, 4 beers might get you drunk, 40 beers might kill you, in that sort of ratio. Any coffee drinkers in the room? Caffeine is 1 to 50. Cannabis is 1 to greater than 20,000. So one joint might get you high. You would have to smoke more than 20,000 joints to overdose on cannabis. Anyone up for the challenge? A few volunteers for that research project. So there's probably a cost aspect here as well. I'm not sure how much a joint costs. Anyone know? But 20,000 joints at whatever a joint costs is going to be expensive to overdose. There's far easier things to overdose on if you wanted to overdose on something. Now, I always thought cannabis was a highly addictive drug, and it turns out it's way less addictive than reality television. Where it sits on the scale in regards to medicines, heroin is one of the most dangerous and addictive drugs. That's number 1. Underneath that, on 1.8 and 1.6 are legal drugs, tobacco and alcohol, and right down the bottom, 0.8 is cannabis. Now, caffeine is not on this chart, but if it was, it'd sit on the chart at 0.9. So effectively, cannabis is less addictive than coffee. So I've done up my own chart here in case of overdose, which is far more realistic. So if anyone's got the number for Domino's Pizza handy and plans on overdosing on cannabis, yeah, go to work. One thing that really surprised me, cannabis was widely sold in pharmacies, including in Australia. I remember at Curtin Pharmacy Department laughing at the bottles that contained cannabis, the old amber bottles. And it was widely used for some of the things we're rediscovering its uses for now, like childhood epilepsy, like chronic pain and terminal cancer pain. And Queen Victoria even used it for premenstrual pain. And some of the names of these companies, they look familiar to me, so I did a bit of Googling. And I found out they're now multi-billion-dollar companies. Some of you might have heard of these names that make a lot of other medicines that people take from day to day that made their start selling cannabis. They no longer sell cannabis, but one day they may well. And there's already been a foray into the cannabis world. One of the Canadian companies have had an investment by Novartis, one of the big pharmaceutical companies. I'm not sure whether it's a good or bad thing, but it might be good for research and their expertise, so we can extend the list of conditions that cannabis is actually good for by doing some research and finding out exactly what does what. So what happened? In 1934, the US legalised alcohol, and the same government department who was in control of alcohol had previously said that cannabis caused no harm. They now found themselves out of a job. So as my opinion, as a direct result of being facing unemployment, they went after the big demon cannabis. And at the time, most of the people who used cannabis recreationally were the Mexican immigrant workers, blacks, jazz musicians, etc. White people didn't really use cannabis. They didn't know it. It was a weed because it grew quite readily on the side of the road. But they largely demonised it on the basis of the fictional movie called Reefer Madness, which proclaimed that cannabis users were turned violent and sex crazed. And they convinced enough politicians to ban cannabis. And at the time, the medical community, including the American Medical Association, came out in support. And the head of the American Medical Association, Dr. Woodward, supported the cannabis use as a medicine and tried to overturn it, but he was overruled. And in 1936, the US banned cannabis. 2 years later, Australia followed suit. So the plant itself is very, very complex. There's lots of different ingredients. At last count, there was 144 different cannabinoids. Don't worry, we're not going to test you on them today. There's only 2 you really need to know in practical terms. That's THC, the bit that gets you high, and CBD, which is non-psychoactive. But there's lots of other cannabinoids in there. There's literally years and years of research that scientists haven't been able to do up until now because cannabis has effectively been banned for the last 80 years. It is still federally banned in one of the world's biggest hotbeds of pharmaceutical research, the USA. I'll talk about that a bit later. So, but there are lots of other cannabinoids. They're only just starting to now unlock what does what, and down moving forward, you might see some of these other cannabinoids on labels of cannabis products. Hands up here, who's heard of the endocannabinoid system? Quite a few, which is good. It's a real-life homeostatic system within our body. Please Google it. That's responsible for such things as pain, appetite and immune function, and it's only just starting now to appear in first-year medical textbooks as proof it exists, but it does exist. It was discovered by some of the same scientists who first identified the THC molecule in Israel back in the 1960s, Professor Raphael Mechoulam. He went back and did a bit of work and discovered this system. And he found there was receptors around our body, CB1 and CB2, that our body produced cannabis-like chemicals, or endogenous chemicals as they call them, anandamide and 2-AG. And when cannabis works, it mimics these two chemicals. And I found out there was no endocannabinoid receptors in the brainstem, the part of the brain that controls breathing and respiration, which explains exactly why you can take as much cannabis as you can fit into your body and not overdose, because your heart's still going to keep beating and you're still going to keep breathing, unlike opioids that do have receptors there. So I really want to make a big point of the blood levels you get when you smoke cannabis versus when you take it orally. Now, most medicines that are being released at the moment come in an oral format or sublingually, things like capsules and tablets. When you smoke cannabis, I don't believe smoked cannabis is a very good delivery method for pharmaceutical cannabis. It's good if you want to get high, but pharmaceutically, most of the patients using cannabis are chronically ill patients who need good levels over throughout the day, like a blood pressure tablet, like an antibiotic. You want nice flat curves. Now, when you smoke cannabis, the line in red, you get almost massive amounts of THC immediately. That drop off after an hour. So you smoke cannabis, you get high for an hour. This chart reflects it. You get low levels for the next 3 to 4 hours. You're still getting good pain relief there. You're not getting high. When you get high using cannabis, you're getting too much cannabis delivered over a short space of time, particularly the THC component. Whereas when you take it orally, it takes a little bit longer to hit your system, up to an hour. Less if you take it sublingually. You're getting good low levels over a 24-hour period. You may need to dose 2 or 3 times a day to maintain those levels, but you're getting good levels without the side effects of getting high. Considering only about 10% of Australians smoke, it's not a very good delivery method, and people that smoke take different amounts of smoke into their lungs. So I'll take all the questions at the end, actually.
What does sublingually mean?
So under the tongue. Yep. So as far as evidence, some people have said there's no evidence that this. Some people say cannabis is good for everything. Now, there was a really good report, if you fancy reading, produced by the National Academy of Science, Engineering and Medicine. I'm happy to email you a copy. They released this report in January 2017, and it really states quite clearly what the benefits are, what conditions are good using medical cannabis, what needs more research. They looked at every single research study ever done on cannabis, thousands of studies, and found there was good clinical evidence, i.e. random controlled trials, for 3 main conditions. And I'll just run through them quickly. Chronic pain, that's the biggest one we see people using medical cannabis for. It's probably about 70% of the patients using medical cannabis in Australia, around the world, are using cannabis for chronic pain. Compared to opioids, opioids are highly addictive. They have this side effect of killing people from overdose, and 90% of people using opioids have problems with constipation, which isn't ideal. Now, they're really, really good for acute pain when you first do an injury, but for chronic, long-term pain, they're largely ineffective. Medical cannabis, on the other hand, has proven benefit for chronic pain, but it also, in my opinion, helps a few of the associated symptoms of pain, things like nausea. Most people with chronic pain don't want to eat. It helps patients sleep at night. There's a sleep study being carried out now in Western Australia. It is mild anti-anxiety as well. So it helps all these things. We've seen a couple of patients being able to reduce some of their other medication in their profile. So rather than potentially being a gateway drug, I see it as an exit drug from some pharmaceuticals, but particularly good for chronic pain. Cannabis is really good for nausea and chemotherapy patients. We've got some other really good anti-nausea drugs. Some of you might have heard of Maxlon or Stemetal. They're really good for nausea and vomiting. But for some patients undergoing chemotherapy, they get this low-level nausea with metallic tongue. They don't feel like eating at all. Cannabis gives them effectively the munchies, promotes the appetite. And in some palliative care patients, they get enough of an appetite to share one of the last meals with their family, which is quite important in some cultures. Actually, I don't know, there are too many cultures, it's not important to share a meal with your family. MS has good benefits, particularly in spasticity and pain, and we've seen a couple of West Australian MS patients have it to really, really good effect. Above other treatment options they've got. Now, since this report, in 2017, there was also a really good report that brought the condition of drug-resistant epilepsy across the line. Once again, we've got some really good drugs for epilepsy. There's about 10 of them, but for 35 to 40% of patients, none of them work. They suffer from this condition called drug-resistant epilepsy, and nothing works. They still have, in some cases, up to hundreds of seizures per day. And we've seen some of those patients become seizure-free or greatly reduced seizures using medicinal cannabis. This report says about 40% of drug-resistant epilepsy patients have a reduction in seizures. I'm just going to play, if there's any sound, this video really quickly. No, there's no sound, so I'm actually going to move on. Forget about that. So I was going to show you a video of a little girl as a case study, and personally, I've started out a real skeptic that this was even medicine, but we've literally met hundreds of patients, some very, very conservative, that have found great benefit from medical cannabis. One particular mother of an epileptic child, she had tried the 10 most common medications. She went on to try 10 experimental medications for her daughter's epilepsy, including one which cost her $55,000 for 3 months' supply, and still didn't work. You'd be pretty annoyed. She tried open brain surgery for twice, had a slight reduction in seizures, and then she tried medical cannabis and became seizure-free largely for the last 3 years with a couple of minor exceptions. And for some mothers, they've told me personally they've literally had to lay awake at night hoping that their child doesn't have a seizure and die. And I can quote all the science till I'm blue in the face, but when you speak to these mothers that have themselves come from a conservative viewpoint and been brought up to think cannabis is a legal recreational drug and have come to this thinking, then it's changed my mind onto what I like to call team cannabis. So that's where we are with the evidence. This is the really exciting part in my viewpoint, and I put these up here just to show you where the research is going on. By no means are these conditions across the line. The top one, PTSD, in my opinion, is very, very close. They widely use medical cannabis in Israel. It's paid for by the government for the Israeli Defence Force to use medical cannabis, and 22% of the Canadian veterans' budget is spent on medical cannabis because they know it works. There's a few low-level research studies, but they do need to get the clinical trial across the line that shows conclusively it's good evidence. No one's done that study effectively because it's been hard for them to do research. The biggest one in my mind, my thinking, is dementia. There's a huge problem with dementia in Australia and around the world, and it's thought 1 in 10 people above the age of 65 suffers from dementia, and that includes Alzheimer's and Parkinson's. And we've got some great drugs in pharmacy. but they're largely ineffective for a lot of these patients. We've got no treatment options currently for these patients. And one figure up here really surprised me is, if you look at all the nursing home patients in Australia, 52% of them have some form of dementia, which is massive. It's a massive toll. Some of these patients have got no other treatment options, and there's been some low-level research that shows medical cannabis may be of benefit, but they do need to do the research study that does prove it. And there's also some really interesting anti-cancer work going on. In Western Australia, there's a researcher doing some work on pancreatic cancer. And whilst cannabis alone doesn't extend patients' life, or chemotherapy doesn't extend the life of pancreatic patients, they've got a very poor prognosis. They've got something like a 3% survival rate, which hasn't changed over the last 50 years. But he's done some preclinical work, and there's been a couple of anecdotal cases that show cannabis and chemotherapy together are more effective in this particular cancer. Once again, he needs to finish his study, and there's been a few other researchers we've been to visit, one in particular in Israel, who's doing some work. But it certainly isn't a silver bullet for cancer. There's 100 different types of cancers. All of them are different diseases. There's hundreds of different strains of cannabis, all of them are effectively different chemicals. So some people that bandy around that cannabis cures cancer are giving people false hope, in my opinion. They do need to do the research study. Cannabis is really good for cancer patients for nausea, and I'd jump on it if I had the need for taking it, if I had nausea during chemotherapy, but it certainly isn't a silver bullet for cancer that some people say it is. So I just want to talk about cannabis and driving, and particularly important, I got pulled up RBT. I thought when I drove off I should have asked if the RBT only detected alcohol, whether it detected cannabis in your system. I would have been safe on both accounts. But one important point I want to make is when you smoke cannabis, as showed by that chart, you're only really impaired for an hour. Cannabis in your system can be detected for up to 2 months. So it's not really fair to say that if you've got any cannabis system, you shouldn't be able to drive. Now, they should quantify it by levels. Some of the kits only detect cannabis in the system. So the golden rule of thumb, if you're impaired, you shouldn't drive. And some of the medical cannabis patients have had their driver's license taken off them, or been told emphatically they're not to drive, or if you need to drive anywhere, get a carer, catch a taxi or an Uber. But in Western Australia, they actually, I think that the police guideline is you need to have not smoked cannabis for 4 hours, which is probably the most sensible of every single state in Australia. In Canada, they're looking at revisiting it because they're actually have a problem with it. In most states, they can't detect whether patients have a legal amount of cannabis in their system. So they're looking at the old school sobriety test so they can detect it that way. But I have seen some data that shows when you're impaired with cannabis, unlike alcohol, you're more aware of your impairment. As a result, you do drive slower and you leave a bigger distance between yourself and the car in front of you. Alcohol and cannabis is actually really bad to combine the two. It multiplies the impairment. There's a picture of my basement at home, ready for the green rush. Yes. It's actually a Canadian grow facility. Very, very important to grow cannabis pesticide-free. Thus, it's quite widely grown indoors, and they can also get 3 to 4, sometimes more crops per year. And they can exclude pesticides and control every aspect of the life cycle of the plant, including airflow, temperature, water, pH. And my wife and I, we've toured a number of facilities like that. They're great. They're really, really exciting places to go. And some of the ones we've been in Canada, there's a large number of the employees wearing these white aseptic suits that are ex-Canadian Mounties. And they've got this running joke that as a job for years and years, they used to kick in the door of drug dealers, and now they make their living trimming bud. So cannabis, to get to the pharmaceutical product, they need to extract the oil from the flower, not the leaf. And they use machinery like this. This is some CO2 extraction equipment. They might do ethanol extraction, which is equipment out there. They end up with this yellow mush here to the left. They get rid of some of the chlorophylls, the waxes, and end up with the good stuff, the brown there to the right. And that they then formulate and medicate into things like capsules, sublingual tablets and sprays, tinctures. Most of the products in Australia tend to be in oil formulation at the moment, but they're moving forward. There's some really good sprays and capsules coming out forward because they're what I call pharmaceutically elegant dosage forms. And I think you'll see in the future that you'll see literally cannabis in a capsule. There is one product called Sativex that is approved in Australia, but it's got really quite a few problems. One, it's refrigerated, and as a result, it's really, really expensive, about $1,500. So most of the commercial products in Australia tend to be about a fifth of that price. Here's a picture of a nifty piece of technology coming out of Israel. It's a cannabis inhaler that connects to a patient's smartphone. And it's really cool because the doctor and the patient can have a record of their dosage and monitor in real time and adjust it accordingly. I'd really like to see this technology applied to Ventolin inhalers or other asthmatic inhalers. Nothing to do with cannabis, but it's really taking really good use of modern smartphones, which everyone's got nowadays. Just a quick tour around the world of what's happening. We've been to Israel. There's a lot of research going on there. They've got a population of 30 million people, 8 million people, and 30,000 medical cannabis patients. It's a system set up by the government. They've got a universal healthcare like ours, and there's currently only 8 growers approved. Quite a few of them have got links to Australia. We met a couple in Sydney last weekend for a conference. They're looking at legalising the export of medical cannabis sometime over next year, so you might see quite a few really well handcrafted Israeli products, including that inhaler, moving forward. The US is a bit of a patchwork quilt of cannabis laws. It apparently follows Democrat and Republican voting lines, with the exception of Alaska. But there's a whole bunch of cannabis legal states on the West Coast where you can buy it just over the counter. There's a patchwork quilt of medical cannabis legal states, and there's Colorado on its own. Colorado's actually got a lot of economic benefits because all the states around are illegal. They get a lot of medical refugees, and as a result, house prices and factory prices are booming because they're all full of cannabis dispensaries or growth facilities. And at the last federal election, they had 9 American states have a referendum when they're voting in President Trump. And of those 9, 8 of them decided to legalise cannabis. The one state that didn't was Arizona, where the gambling lobby ploughed $6 million into their anti-cannabis campaign because they did some sums and found they stood to lose $100 million because people gamble more when they're drunk rather than they're stoned. But of the governments that did legalise cannabis, California legalised it recreationally starting on the 1st of January. They did some sums and found they were going to make over $1 billion each year in cannabis taxation, which is good for their economy and is ploughed into a lot of other things. I know Colorado, they spend a lot of their cannabis taxes on things like schools, women's refuges and drink driving campaigns as well. So federally, cannabis is illegal in America. I know everyone likes to say, well, they do this in America, but federally it's illegal. They've still got a lot of problems with their system, and they can't transport cannabis across borders. There's some states where it's completely illegal, and they can't export any cannabis products. They can't do any research. We were there recently, there was a whole bunch of very, very talented researchers. They can't do cannabis researchers. We invited them all to come out to Australia and set up their research labs out here. And we are speaking to quite a few of those scientists with regards to their expertise, because it's important they do the work that they do so we can work out exactly what cannabis can do. So most of the US states, apart from one, has got a dispensary model, and this is one of the nicer ones. We visited quite a few. They carry a range of medical cannabis products. It varies from state to state. Some they need a referral from a doctor, some you can just walk in and buy whatever you want. Some specialise more in recreational, some specialise in medical. But it's one of the only countries anywhere in the world that's got this dispensary model, and I don't think it's very appropriate because cannabis has got some really good medical uses, but they're handed out by largely untrained medical staff who don't have an overall picture of someone's health. They'll always recommend cannabis, whereas as a pharmacist we were taught to only recommend a drug if it's appropriate. And there's been few patients contact me seeking cannabis, and I've personally felt their other drugs are more appropriate. They don't have an understanding of any interactions, and I've seen a number of patients need medical cannabis, but they also need their overall health looked at, including the vitamins they take. People go and see a locum doctor, they see their regular GP, they see a couple of different specialists, they get admitted to hospital, they get put on all these medications. Sometimes you need to look at people's overall medication picture to help them. So this is my wife do a bit of shopping in the dispensary. They're really nice places inside. They're designer. Some cater for a young, funky crowd. There's a growing number that cater for the elderly, which are big cannabis users, because most of the conditions are, suited to what the US call baby boomers or elderly patients, like chronic pain, palliative care, and cancer, nausea. So. This is a cannabis billboard. I just want to make it very clear that these are in states where cannabis has been legal 20 years. We've been legal 1 year, and a lot of people are quite frustrated. We haven't opened up dispensaries on every corner and got cannabis billboards, but this is at the end of a 20-year process, and we may well get there, but these things happen over time, and most drugs are down schedule over time. The Canadian system is much more sensible. They've got a federally legal medical cannabis. They've got, at last count, 300,000 medical cannabis patients that have each got a prescription from a doctor, and they've got a population slightly more than us. Now in a couple of months, the 1st of July they're supposed to do it. I think they're going to be delayed by a month or two, not too long. It's definitely going to happen this year. They've progressed to legalise cannabis for adult use, which means anyone can walk into a store or order it online without a prescription. You've got to be over 19, and there's a few other restrictions, and every state varies on how they're going to give it out. Thankfully, a lot of pharmacies are getting on board because they're really happy to get these patients back in their pharmacy. As I said, they can counsel them on all drugs that they're using. A lot of pharmacy chains are really keen to sell medical cannabis moving forward. So we're just in Colombia, great place. They've got a population double ours and a land probably a seventh of ours. They're right on the equator, and they're really well suited to grow cannabis because they've got the same amount of sunlight every day of the year, and they're gearing up to be one of the biggest producers of cannabis to the worldwide market. They've already got an extensive quota, and they've issued a number of growing licenses. We were lucky enough to present at a conference over there, the very first cannabis science conference, and my wife described them as a room full of supermodels. They're all very formal over there with jackets and very well dressed, and a couple from our group went to the Canadian version of the DEA and presented to them. They presented at universities, and it was very well received. So they're hoping to grow cannabis and export it around the world. So in the future you might see quite a bit of Colombian cannabis on the shelves of pharmacies around the world. This is us at a grow facility in Colombia, a really beautiful spot, and they've got this particular place had I think 350,000 square metres of grow space they were setting up to grow cannabis in a massive manufacturing facility. So as I said, in Australia they legalise it federally in less than a day. They set up a system that set up cultivation licences, research licences and manufacturing licences, and they've already issued a number of those. There's crops in the ground already. My opinion that will probably a year or two before we start seeing some really good Australian product hit the shelves. It does take time to develop a really good product, and not only do you need to grow the cannabis, that's the easy part, but then you need to formulate it, extract it and do all the back end stuff and make sure it's safe for public use. So this is a picture of my wife and I importing cannabis into Australia. It was one of the very first. It was the very first shipment into Australia, and it was one of the very first international shipments legally of medical cannabis. It was certainly the first one out of Canada. And normally most drug dealers at the airport they duck for cover. But I have to say, I shook every single customs guy's hand, and I texted this picture to a couple of federal politicians, and it was a good day that it's actually been done legally and it's the start of the system. But it only happened in May last year, so we're literally a year into the Australian system. So currently there's 10 ASX listed cannabis companies. None of them have got products to market. There's about 100 non-ASX listed companies. They've adopted a very strict medical model. Now initially when they set it up, they put it at a very high level, but it's my prediction over time, and it's already happening, that you'll see more and more patients, more access, there'll be more conditions added to the list. Currently there's 6 conditions. I've gone through most of them. They are prescribing or approving some prescriptions for PTSD, and also palliative care is the other one. So this is some of the very simple paperwork required in West Australia currently to receive medical cannabis. That the West Australian Health Minister Roger Cook has actually pledged to get rid of all the red tape and just have this yellow box down here. Up until now, it's taken prescribers up to 2 months to prescribe medical cannabis. They are looking at adopting a federal system where applications take less than 48 hours. That federal system, in my opinion, is very, very efficient. And we've seen some applications come through within 2 hours. So I think come July, the application process is going to be a whole lot easier for prescribers. There's going to be even more prescribers. And the short term, the last couple of months, we've seen a lot of prescribers gearing up for that to write more medical cannabis patient prescriptions for their patients. And some of them have seen some initial results of their patients and some of their colleagues, and they're quite happy with the results. The sky hasn't fallen in. That's the federal approval. So currently patients need to get TGA approval, which is the federal approval. That is the easy part. That's coming through as quick as 2 hours, definitely within 48 hours. In my opinion, most of the applications are coming through same day. But to give you some idea, there's 13 members of a West Australian committee. I'm told some of them are anti-cannabis. They meet once a month. They didn't meet at all in January because, like you and I, they were holidaying. But unfortunately, sick patients they get sick. They don't take holidays. So there was a couple of patients who couldn't access it in January because the committee simply didn't meet. So I think medicine. The medicine has already been approved to import in Australia, and it's being approved at a federal level. The West Australian approvals, in my opinion, are a duplication. They don't need them. There's no benefit to the public by having this separate approval. They have set the bar too high. And the WA Health Minister is addressing that, and in July it's slated to be a whole lot easier to access it. So if anyone here has tried to access it up until now, that's been the system up until now, and currently it will change in July. So those nasty opioids I was telling you about, just as a bit of a side note, this is a picture from Tasmania. Australia grows 70% of the opium poppies for the world pharmaceutical opioid market. You might be surprised, but we export them all. We don't manufacture it here. We export them all from Tasmania, and there's farmers in Tasmania and around Australia gearing up to do the same with cannabis. And hopefully Australia can export our cannabis. And I think we're particularly well placed given our proximity to China and also the reputation of Australian products is good. We've got a clean food chain, and Chinese at the moment are going nuts over our vitamins and baby formula. Baby formula sells in my pharmacies for less than $20 on the streets of Hong Kong or online, and it sells for up to $50 because they don't trust their own baby formula. So this is a picture I took in Israel of a cannabis vending machine. There's none on the streets of Perth at the moment, but moving forward, who knows? This might be down-scheduled enough. I think they'd be trashed pretty fast if they were at the moment. But I see cannabis as a bit of a pharmaceutical disruptor. It has its uses, particularly in the area of pain, and there's quite a bit of research going on for neurological diseases. If you wanted a couple of my safety slides, I'm more than happy to email them to you. Or if you want to follow what we're doing, my wife and I also run a charity, Medical Cannabis Research Australia, and part of the mission of the charity is to educate health professionals on medical cannabis and promote research in Australia. We're speaking to a couple of scientists at the moment. We're just about to launch. We've been connecting scientists around Australia in our talks. So please feel free to follow me on Facebook, Paul Ronald Mavor. I'd like to take any questions now. If anyone's got any questions, just stick up your hand. So most of the products on the Australian market comes in the form of oil. It's given under the tongue because it works better sublingually, and cannabis is actually better absorbed after a meal. So most of the products around given 3 times a day, just a very small amount. They come with a dropper, and there's, as I said, 6 conditions being prescribed by doctors and specialists.
No, you're saying how they talking about growing them in Australia, and they're out in the farms and that.
Yep.
So if they're out in the open, are they going to be exposed to chemicals?
That is opium poppies. Cannabis, no. Most of the grows I know in Australia are going to be grown indoors. They do need to be secure. They've grown opium poppies for a long time, and apparently if you eat an opium poppy, you die. There's been a couple of tourists that thought, oh, let's eat opium poppies. They've physically died. Because they're really, really strict, you grow it indoors. Also, as I said, they can turn 6 crops a year effectively, and they need the security. You need to exclude pesticides. You will see most of the Australian crops either in a indoor facility or even a greenhouse.
What about the one in Colombia? Wasn't that growing outside?
That was outdoors. They were looking at experimenting. They chose some land that was quite isolated. They had actually fish farms around them that you're not allowed to have any pesticides anywhere near there. The lands they were looking at previously used to farm rice. They can get away with it over there because they just the laws, and they were looking at a greenhouse grow as well, but they were going to grow it organically. No. Anything. So a lot of people said all the cannabis products on the market are synthetic, they're dangerous, but they're actually grown from plants. Anything synthetic needs to be produced in a lab, but most of the product is extracted and then standardised. So rather than giving someone cannabis, they don't know what the strength is or what it is, they do the test and dilute it down with a carrier oil, such as olive oil, grapeseed oil, and coconut oil, that are largely inert, but they get the medication there and they can standardise it. So it's really, really important that patients get the same amount of medicine every single time. So if you stabilise on a blood pressure tablet, you want your same 10 milligram blood pressure tablet every day. You don't want one to be 15 and one to be 5. So there's this term FECO, or full extracted cannabis oil, and it's a very, very pure substance, and it's very hard to regulate. It's generally dosed with a toothpick. And that's really, really hard for chronically ill patients because they might get a bigger job on a toothpick than others, and it's better to dilute it down into a carrier oil. And most patients for chronic medical conditions, they only need what's called microdosing, particularly cannabis-naive patients. They only need a very, very small amount to activate their endocannabinoid system and achieve the benefit. You got a follow-up question?
Going to be I suppose, if lots of oil when they grow and that stuff is sprayed and all that sort of stuff, so basically organic, I suppose.
All the cannabis needs to be grown organically. They thoroughly test it. It's a pharmaceutical product, so they test the product before, and they test the end product, and it gets tested multiple times for stability. And they do a range of tests for pesticides, microbials, fungus, heavy metals. All these things and solvents, because when they extract it using a solvent, and they evaporate, remove the solvent. So the products coming in are really, really clear and free of any harmfuls.
Because some water's not in fibre, so is it going to be like hydroponic type?
I've seen the tests, and I'd be very, very safe to take it, but I've seen tests of cannabis produced by hobbyists that are full of pesticides, chemicals. I've seen some very good ones as well, but you don't know what you're getting unless it's been tested. So anything coming into Australia, there's a raft of tests that the government needs to see before they actually release it. So and be the same of any cannabis made in Australia. And even if you bought bottled water, they have to do a range of tests behind the scenes before they can release it. So I'll just move down the back of the rooms.
Hi, question is, I know with different strains of plants, you've got your different levels of THC and everything. Now, when you say for somebody to take a tablet, whether it's 3 times a day or whatever, it's 20 milligrams, how are they going to regulate the from when they bring it down to an oil if the THC in that plant is up to 27%?
Okay. Really good question. A lot of people, especially in America, talk about strains. It's purely a marketing thing. And so I've seen some test results of 5 of the same strain tested, and it contains very different chemical makeups. What you're seeing at the moment is they know the THC works for certain things, they know CBD works for certain things. You're seeing a combination, and they need to be able to reproduce that from every dose. So you're seeing THC on a label, you're seeing CBD, you're not seeing Bubba Kush, Jedi, Master on the label, and they're purely a marketing thing. And moving forward, I think some people like those fancy names. There's some great names, I love hearing them, but as a patient, as a medical professional, they're not relevant. They're clouding what is a medicine. I don't think you'll see them on any pharmaceuticals. People I know talk about how certain strains, indica and sativa, is good. The THC and the CBD is more important to vary the levels of those. There are a lot of other really good cannabinoids in there. I'm a really big fan of, I'm not a fan of synthetic cannabis because you're not getting that full spectrum. And then at this point in time, they're not sure what works. And most of the commercial strains of cannabis, they actually use 3 to 4 different lots. 3 different 4 types of plants. How long have I got? The speaker. So I'll take a few more questions. I'll talk as long as you want, but at the end, please feel free to approach me if you've got any questions or don't want to share your questions with the rest of the room. So I'm just going to move down the back of the room. So I'll go for you first.
I've spoken to my oncologist and my GP.
Yep.
And they weren't at all interested in becoming subscribers.
Yep.
And the oncologist said I could have the chemo.
Yep.
As well as cannabis,
Yep.
The oil,
yep.
And I also vape cannabis.
Yep.
And but I think I'm turning his mind a little bit.
Good on you.
Because each time I go there, and
yep.
I see him every 3-4 weeks, I mention that the mouth ulcers are far better. I sleep better. Arthritis is basically, you can forget it. Pain, nausea.
Thank you for being such a powerful advocate, and we're finding this more and more. We need people like you to say to their doctor, hey, I've tried all these other things, and there is a natural progression. People aren't prescribed cannabis as a first-line treatment. They have had to try a range of different anti-epileptics for epilepsy, a range of different painkillers or other nausea tablets. This is the end of the line, and for some patients who've tried all that, this is a treatment option, and there's good clinical evidence. If you want, I can actually email you specific to your condition. You can put it in front of your doctor about and get him across the line. So we've got a really good evidence that's fact check. We can give them, give you. So thank you.
When do you predict that accessibility will be easier? Because, like some people have mentioned, when I was talking to my neurologist, they were very reluctant to suggest medical cannabis as an option, and even they tried to talk me out of going down that route of approval. And
certainly. Do you mind me asking what condition you're trying to access it for?
Epilepsy.
Epilepsy. Okay, so it is a treatment option. It has good clinical evidence that it works. A lot of neurologists are risk averse. If they haven't prescribed something before, they may not be willing to try it. But if you tried everything else and still suffering from seizures, there is good clinical evidence that works. You probably just need to have that discussion. The access system is going to become a whole lot easier in July. 90% of the paperwork is going to go out the window. It's going to be a simple one-page online form. We're predicting the industry is going to go nuts at that stage because there's a lot of prescribers who want to prescribe it. There's a lot of patients who want to access it, but some of them give this reason that they're... That's right.
It sounds silly, but how would we go about getting it? Would it be as simple as having a prescription go going to the chemist?
Yeah, that's simple. We've had patients that have tried for months, in some cases years, to try and access it. They get approval, they bring it in. You can go to any pharmacy in Australia. We can ship the medicine and have it to you within a day.
And there was a lady that was there just before, and she mentioned strands, and I did watch a documentary with a doctor from Israel,
Yep.
and he was specific about a plant for epilepsy that was more inclined.
It comes down to THC and CBD makeup for that plant, and that plant could have been low in THC and high in CBD, but medically in Australia, we can't smoke cannabis. It's not a very good delivery method. It comes down, you're taking a product with a label on that says this has got this amount of THC and this amount of CBD. At any time it can be tested. It's got to stand up to that, whereas plants are subject to variation, and we've seen plants that they're grown outdoors. They might have different amounts of sunlight. They have an entire different chemical makeup, even though they're called the same thing. It's purely a marketing thing, the strains. So it's something that growers. But moving forward, all the pharmaceutical products are.
Primarily high in CBD.
Typically, I have seen some one of the clinics we visited in Chile, they actually use a ratio of 2 parts THC to 1 part CBD, and claim they got up to 90% of patients greatly reduced seizures. That they're about to release a paper. I think it'd be really exciting, because I believe the initial study, which was CBD only, was completely flawed. I'm just going to take one more question, and then we'll do the right thing by the next speaker. Lady right down the back, thank you.
Access is one thing, cost is another. Can you comment more on the cost of the patient once you've got the script?
Definitely, yeah. Great question. There's a few barriers here. Cost is certainly one of them. At the moment, medical cannabis on prescriptions, because it's classed as an experimental drug, it's not covered under the government healthcare system. It is classed as a private prescription that's non-ARTG approved. And they reckon in about 5 years' time, if it goes through all those hurdles, one day it might be on the PBS where you get it cheaper. But for now, it's a private drug. It can be anywhere from $300 to $1,500 to access. That is the price at the moment, because there's only a few hundred patients in Australia. I think at last count we're up to 600 patients. But over time, you'll find that once there's more and more patients, those prices will come down. There will be a number of Australian producers, come on the market. We suspect a significant price drop. We're also starting to have a conversation with some of the private health insurers about subsidising this, because they value a hospital visit at $2,000 per patient per day. Whereas chronically ill patients, if they're on medical cannabis, they're out of, they don't have a hospital visit, it's actually cash flow positive and going to save them money. Tasmania has also put medical cannabis onto their public hospital system, so they're already subsidising. So it comes down, as patients, consumers, you might want to lobby for access through the hospital scheme. So thank you so much. I really appreciate having a full room to talk about cannabis. So I'm happy to keep talking outside if you want to grab me or grab a card or hit me up with some questions on Facebook. So thank you very much to the organisers, and thanks for coming. Yeah, thank you.